Tinnitus is perception of sound with no actual acoustic stimulation. It can sound like a buzzing noise, rushing noise, a whistle, clicks, or a combination of the noises. It can be caused by a variety of reasons. Here in the book, we talk about some of them. For most people, tinnitus is not associated with an underlying disease, with the exception of hearing loss. So hearing loss is very prevalent among people who have tinnitus. About 60% of people who have tinnitus also have hearing loss. And that is why it is important, if you develop tinnitus, to see an audiologist who can test your hearing. So other reasons for tinnitus which can also be associated with hearing loss are impacted wax in the ears, ear infections, and disorders of the auditory nerve. And this is why important that if you develop tinnitus, to see an ear, nose, throat, ENT specialist who can look into your ears, examine your ears, and see if there are any underlying conditions. In addition to medical conditions that can cause tinnitus, there are other factors that can cause tinnitus as well. Like tinnitus can be a side effect of medications, certain medications, or some environmental factors can impact on tinnitus. So the medications that can cause the tinnitus can be the side effects are antidepressants, antipsychotics, opioids, some antibiotics, strong antibiotics like aminoglycosides, and anti-inflammatories, anti-malaria drugs, loop diuretics that you need to use if you have blood pressure, anti-cancer medication such as cisplatin that they use in chemotherapy. So it doesn't mean that everybody who takes this medication develop tinnitus, but some people who have taken this medication reported that they have developed tinnitus or their tinnitus got worse. Among environmental factors that can impact and that cause tinnitus are whiplash and head trauma, that's the most common, and loud, intense noise exposure. So these are the causes of tinnitus, but beyond these medical factors and environmental factors, it is important to pay attention to whether tinnitus impacts on the person's life. Does it cause any distress in their life or not? Some people, tinnitus may not really impact on their life. They can do their activities, concentrate at work, sleep, and their mood is okay, is not affected by tinnitus, which is absolutely good. But it can be a bit tricky to distinguish if tinnitus is impacting on life or not. Because sometimes we can engage in avoidance behaviors or ritualistic behaviors which masks the effect of tinnitus on us. Examples of these are if you become dependent of using background noise or music when you're at work or when you go to bed at nights, or if you avoid certain environments in the fear that tinnitus may get worse. So in this book, we developed some validated psychometric tools for you that you can use to see how confident you are to manage different aspects of your tinnitus, how confident you are that you can do your day-to-day tasks, sleep and relax, enjoy your life fully, even with tinnitus, without having to be relying on avoidance behaviors. You can use these tools for yourself to see if there is any room for improvement. For some people, tinnitus experience can be quite intense. I'm going to read a passage from the book for you. What effects do people expect tinnitus to have? Perhaps they expect annoyance and a sense of failure, unfairness and isolation. Many people, even those with no experience of tinnitus, would agree that if we were hearing an unpleasant noise hissing away in their ears, they would not be able to concentrate at work, read, or make a meaningful contribution to the society. Many people would agree that if they were hearing a horrific constant noise, like a demon trapped in their head, screaming out loud that it wants to get out, they would go crazy. These were the words of a patient of ours, which was in a psychiatric ward. He in fact wanted to put a hole in his forehead to let this demon out. With tinnitus, how can we enjoy normal day-to-day activities or to get any work done? How can we get enough sleep and remain healthy? Sleep is a very important factor and is very much connected to the way that we feel, whether we are healthy and refreshed or not. And that is one of those key areas that tinnitus can impact on us. Most people would agree that they would not be able to do any of these with an intense experience of tinnitus. For some, this intense pressure can cause aggression. Here is what a patient in our clinic said about his tinnitus-induced aggression. I have very vivid memories about this patient and this scenario. So he was saying, it is like being under the worst tension that I can possibly be under. As I said to the psychiatrist, if somebody told me to rip your head off, Hashir, to stop this agony, I would consider it. Even though we are friends. I like you, but this is not a good place to be. Since 4:30 in the morning, I have had no sleep, and this has been going on since last Friday. The noise in my head is the worst it can get. Put me in a war zone. I will fight everyone in sight, including my own comrades. Please stop it. This is too intense. This may not be a typical experience of tinnitus, but it clearly demonstrates a state of mind in which horrific actions may be contemplated in order to escape from something unbearable. Such a state of mind can occur when we experience anything that produces overpowering emotions. One example is when we are in love. In Shakespeare's Romeo and Juliet, Juliet felt that her life would be meaningless without Romeo. She preferred to be chained with roaring bears or to be hidden with a dead man in his tomb with rattling bones, reeky shanks and yellow chapless skulls over losing Romeo. We may not be able to see how we can live with tinnitus, just as we may be unable to see how we can live without the person that we love. As they say, love can blind us, so as the fear, so as the anger. So there is a very clear emotional disturbances that can be caused by tinnitus. But there are many research studies, some of them in our own clinics, that shows that between tinnitus and the emotional disturbances that it causes, there are cognitive behavioral processes. And this book can help you to recognize some of the thought patterns and behaviors that you may have in response to tinnitus. And it teaches you skills to test them, to see whether they are helpful or they are counterproductive, and modify them accordingly. So I want to read a passage from this book which I think is relevant to this. Woody Allen's 1986 comedy drama, Hannah and Her Sisters, provides a nice illustration of this point. The film was one of the Allen's biggest box office hits, and it won Oscars in several categories. The character he plays in the film was a hypochondriac. He visits his doctor for some slight hearing and balance problems. When the doctor asks if he hears a ringing or a buzzing in his ears, Allen's character realizes that he does, and he immediately wonders if he is going deaf. Once the result of the hearing tests are back, they show a significant hearing loss at high frequencies. At the beginning, he says, well, that's not a big deal, perhaps I don't go to the opera. But then when the doctor suggests sending him to the hospital for further tests, he becomes frightened by the possibility that his tinnitus and hearing loss could be a symptom of something much worse. He starts searching for possible causes and consequences of his symptoms, but this was before the internet and Google, so he resorts to calling some of the doctors that he knew. One doctor explains that hearing loss can be hereditary or the result of an infection or a loud noise, but Woody's character asks if it could be something worse, and the doctor says, well, in the dark side of the spectrum, it could be a brain tumor. From that moment in the film, Woody's character keeps checking for the ringing in his ear and attributing any problem that he's experiencing to his tinnitus. He thinks that he hears tinnitus every time that he blinks, and then he wonders if he's going blind too. He can't take his mind off the buzzing. He cannot sleep at night. He has lots of negative thoughts about the brain tumor. He's consumed by internal battle with his own negative thoughts. Sometimes he tries to convince himself that he's just jumping to conclusions and that he will be fine. He tries to reassure himself by remembering that he is in the middle of New York City, surrounded by familiar people and places with some of the best doctors in the world. He says, nothing is going to happen to you. You cannot just one day vanish. Keep calm. You will be okay. Don't panic. But the more he tries to get rid of his negative thoughts and reassure himself that he's fine, the more anxious he becomes. He feels very panicky and thinks that he will die as a result of his tinnitus and underlying brain tumor. So this illustrates that trying to simply reassure ourselves and try to relax is not going to solve the problem of the distress caused by tinnitus. Here in the book, we describe it this way. To recover from tinnitus distress, we need to take a very systematic approach. This book helps us to achieve this by reviewing facts about tinnitus and how to assess our symptoms by motivating and preparing us for behavior changes, by teaching us the techniques of CBT or cognitive behavioral therapy, by helping us in developing the willingness to live a satisfying life even with tinnitus, and by facilitating learning using metaphors and thought experiments. So I hope you enjoy reading this book and find it helpful. Please make sure to rate the book and leave your feedback on whatever website that you purchased the book from. Thank you very much for listening.
My name is Brian Moore. I'm Emeritus Professor at the University of Cambridge. Emeritus means that I officially retired some years ago, but I have still remained active in research and in writing. Now, this book was initially conceived by Hashir Aazh, the first author of the book, but he asked me to cooperate with him in writing the book. And the book is intended to help people who suffer from tinnitus, who are bothered by tinnitus. Now, many people, perhaps 20 or 25% of the population, have tinnitus some of the time, but most people are not bothered by it. It doesn't disrupt their everyday lives. But a small percentage of people have really bothersome tinnitus that disrupts their everyday life, prevents them from enjoying life, prevents them from doing their work adequately, and so on. So the book is aimed at those people. Now, it's possible to get treatment for tinnitus through the National Health Service, but there are relatively few centres that do this, and those centres have long waiting lists. So there are many people who don't have ready access to any form of treatment or therapy for tinnitus. And our goal in producing this book was to help such people. So essentially, it's a guide to helping yourself deal with tinnitus. And we start with the basic concept that's well accepted that at present, there is no cure for tinnitus. There's no pill you can take that will make tinnitus go away. There's no injection you can have. There's no surgery you can have. And so the only treatments are basically therapy treatments that are helping you to deal with the tinnitus. And this particular book is based on something called cognitive behavioral therapy, which is a psychological approach which aims to help you deal with the tinnitus and live with it adequately. We don't promise that the tinnitus will go away as a result of this, of reading the book or going through the program in the book, but we help we hope that the book will help you to actually deal with the tinnitus so that you can learn to live with it. And this involves modifying your own thought processes about the tinnitus. And that's what cognitive behavioral therapy is about. And we start with the idea that people are distressed by tinnitus because it feeds back into various other things. The tinnitus may evoke sensations of fear or agitation or anger, and these emotions may in turn feed into bodily sensations. You may have a raised heartbeat, you may perspire, generally you may feel twinges in your stomach, typical of anxiety, and this may make your tinnitus worse, and the whole thing goes around in a vicious cycle. And the therapy is aimed at breaking that cycle via this process of cognitive behavioral therapy. I won't go into all those details about how it's done, but the idea is that if you follow the program of therapy in the book, you can evaluate your process as you go, your progress as you go along. There are various questionnaires that you can fill in to see how you're doing and to convince you that things are improving as you proceed with the therapy. So as you learn to deal with the tinnitus and not become so stressed by it, you don't concentrate on the tinnitus so much. It is no longer the focus of attention, and eventually it fades away into the background so that most of the time you're not even aware of the tinnitus. You're concentrating on other things around you. And that our ultimate goal is to reach that stage.
So my name's Patricia Pugh. I've been an audiologist in South Wales since 1999. I studied for my MSc in rehabilitative audiology in 2010. And I've been specializing in seeing tinnitus patients and patients with hyperacusis since 2006. So I've got quite a lot of experience in the field of audiology and the speciality of tinnitus. I think one of the best aspects of providing CBT for patients is the fact it allows me to support other people empower themselves to take control of the thoughts and the emotions that they have in relation to their tinnitus. And there is nothing better than watching a person's confidence grow week after week after week as they discover that they can actually live well with their tinnitus as they become experts in the techniques that we teach them. And to be able to deliver that online, so the sessions are taking place in the comfort of a person's home, is even better. We can reach so many people basically as long as you have internet. You can take part in the program. So it's pretty magical to be a part of that. It's a privilege to be a part of that. So the self-help book is a fantastic tool that an individual can use to allow themselves to progress in the management of their own tinnitus. Again, it's a very empowering tool that a person can use at their own pace in the privacy of their own home. It's also a very good supplement to the program that we can provide. So in addition to us supporting a person through the exercises, they could have the book to do that extra bit of background reading as we're going through the program with them.
Hi, everyone. Hello. Oh, that was good. Could we do that again? Hi, everyone. Beautiful. My name's Helen Jane Campbell. I'm an author and coach. I'm here today from Hay on Wye. which, as you probably know, is a town full of bookshops. I'll be hosting you this evening and interviewing Dr Hashir Aazh and Professor Brian C.J. Moore about their new book. Hopefully you've all got a copy already with you. Their book, Living Well with Tinnitus, as we celebrate its publication and its launch together. As many of us in the room may find this easier on our ears, I'd like to invite you to wave your hands in the air instead of clapping. Can we practice this? Yes, very good. Perfect, you've got it. It may be easier on all of our ears. In this book, Living Well with Tinnitus, Robert Sweetlow's introduction describes tinnitus as the unwanted auditory intruder, estimated to be experienced by as much as 30% of the world's population. He also notes that it is sufficiently devastating to have a significant negative effect on the quality of life for 1 to 3% of the world's population. So, if this resonates with you and you've made it here today, I'd like to invite you to send some gratitude to yourself for showing up, because that in itself may not have been easy. So well done for being here. I'd also like to warmly reassure you that you're in excellent hands today. Dr. Aazh and Professor Moore are two of the most respected names in the field of tinnitus management, psychoacoustics, experimental psychology, and hearing disorders. Between them, they've published hundreds of scientific papers and textbooks, and they've consulted with or managed thousands of tinnitus patients. We're going to hear from Mr. Don McFerran, a retired ENT surgeon from Colchester, for around 10 minutes, and then from our authors, Brian and Hashir. And after that, we'll have a 25-minute break, followed by a Q&A from 6:15 to 7. And feel free to find me in the break and pass me any questions, especially if you're feeling a bit shy. There's some pens and paper at the back. You can write your questions down and just quietly slip them to me. But if you're not shy, we have Laurie and Daniel are going to be the roving microphone assistants this evening. And so you can ask your Q&As in the session. And I've also got a few questions that I'd like to ask on your behalf as well. So that'll take us to 7. And then please do stay on from 7 to 8, because you can then have your book signed and you can obviously meet the authors and have a conversation. So once again, thank you for being here with us. And let's practice that lovely hand-waving applause again to get us started as I hand you over to Don McFerran.
As you've just heard, I'm a retired ENT surgeon, and that's my office, my operating theatre. I specialised in otology, which is conditions of the ear and hearing. I've also had a long relationship with the British Tinnitus Association, almost 20 years in fact, and I'm currently the president of that organisation. I'm also an educator and a researcher, and I'm also the author of a tinnitus self-help book. And that's a picture of my book, and these are my co-authors. That's Lawrence McKenna, and the guy there in the middle is David Bagley, who sadly died in June this year. And you might say, well, what on earth am I doing at someone else's book signing? It does seem a bit sort of self-defeating on my part to support someone else's self-help book. I'll try and explain a bit, and I think the simplest way to do that is to give you my sort of view of tinnitus, how I try and explain tinnitus to people. And there are various definitions, Hashir, in his book, has very carefully avoided making any real definition. He says that if you've got tinnitus, you already know what it is, and you don't need an explanation. It's certainly very common. Right now in the UK, we estimate that about 1 in 8 people have it, and as Helen said, the lifetime risk is probably somewhere around 1/3. There's no gender divide. It happens to all age groups, including children. The number of people with it increases up to the 7th decade of life, and then, curiously, it seems to plateau or even become less common after that. There's no recommended drug treatment. There is no cure. And there's often little real support from the conventional medical pathways in the country, and the fact that this room is full probably kind of proves that. If we opened a sort of an encyclopedia of the ear, or asked our GP to describe how hearing works, we'd probably hear something like this, that there's an eardrum, there's some little bones that conduct the sound through, and then there's an inner ear, a cochlea, which turns the sound, the mechanical sound vibrations into electricity. And that's how a lot of people kind of think of hearing. And if you think like that, your model of tinnitus is that it's one of damage to that organ, the little microscopic hair cells in the inner ear. And if you think like that, well, that's why GPs come out with the statement that, yeah, you've got tinnitus, there's nothing that can be done about it. But there are some paradoxes with tinnitus. You can have tinnitus and have a perfectly normal audiogram, a perfectly normal hearing test. Brian and Hashir go into that in their book, and they say, well, if you look hard enough, you might find that there's little bits of damage. However, you can certainly have a substantially normal hearing and still have tinnitus. It is more common if you've got hearing loss, but the degree of hearing loss doesn't correlate at all with the degree of tinnitus. And it's possible to have really awful hearing and not have any tinnitus. It's even possible to cut through the auditory nerve and still have tinnitus. So what's going on? Why? We need to think a bit more in depth about the auditory system. We need to think that actually the auditory system is not just the ear and the auditory nerve, but it's lots of things that go on in the brain too. And I've simplified it here. These are actually pictures from our self-help book. There's a box that we call filtering and pattern recognition. And this is it's like the information goes from the ear into the brain, and then the brain decides what it wants to listen to and what it can safely ignore. So it's the switch that if you're in a party and someone mentions your name across the other side of the room, you go, ooh, who's talking about me? And you tune into that conversation. On the flip side, you can tune out of things too, and it's the filter that allows men to completely ignore whatever their wives are saying. If it decides that stuff can go through that, it lets it through to the cortex, that's the thinking bit of the brain, the conscious awareness bit, but it also has a link to our emotional brain and to our adrenaline center, our fight or flight center. And here's a little slide of everything working as it should work. So there's music coming in here, the ear is doing its business, it's turning it into a digital stream of electrical information. The filters say, yeah, I'll listen to that. So I'm aware that there's music playing, and it's giving me pleasure or excitement or whatever other emotion is in that bit of music, and I'm getting the appropriate response from my autonomic nervous system. These nerves in the auditory system, though, they're not like wires in a bit of electrical equipment. Even when there's no input, these wires are, the nerves are electrically active. There's always some background activity. And normally, the filters block that and nothing happens. But sometimes that process doesn't work. And the two common things are, if your hearing is going down, the filter's open to let more auditory information through, but they also let this electrical junk through. The other thing that can happen is that if you're under stress, this can make the filters open and let information through. And if that happens, we then set everything up to trigger off a series of vicious circles. And once that's up and running, this bit over here, the ear, becomes unimportant. This is the main bit. So if we look at it in this way, there's the tinnitus sound, which, as Hashir and Brian point out multiple times in the book, the CBT and other treatments do not help. But there's the reaction to that process, and that's where the treatments like CBT, cognitive behavior therapy, have their effect. Of course, we're humans, so we make things more complicated, and we go off and we think about things, and we have different personalities. We've looked a bit at that in our research, and tinnitus people definitely seem to have overrepresented with the perfectionist gene. And we also have a lot of life circumstances happening that play into this too. Our book, it's a very detailed explanation of tinnitus, and it explains all the different subtypes, and it explains all the information about food and drink and drugs, and it was designed as a multidisciplinary approach. So the three of us all had very different approaches to tinnitus, and we all brought our own little bits into it. And there isn't a single thread to the book. It's multiple threads. It does explain a bit about CBT, but it doesn't take you through the process fully. In contrast, Hashir and Brian's book, they do explain tinnitus, but it's a pretty brief bit. It's one relatively small chapter in the book. But then the rest of the book starts off in a step-by-step explanation about using cognitive behavioural therapy to manage tinnitus, to treat tinnitus. It's got multiple, you flick through it, I'm sure, multiple practical worksheets for you to fill in yourselves, or if you don't want to mess up your book, for you to photocopy and fill in. I don't know, are you going to... online. Or get them online. It gives very comprehensive advice about when to use tinnitus, when to use CBT, and also when not to use CBT. And there's also a very useful bit at the end about, if you've been successful with this approach, how to maintain that success and what happens with the inevitable little setbacks that we all experience. Having read the book cover to cover, I would agree with what the authors themselves say, which is, it is not a quick fix, it is not a cure, and it is not easy. You will need to put in a lot of hard work yourselves to make it happen. And it's going to take you at least 2 months to work through that process. Once you've done so, actually, a lot of, although it's tinnitus directed, a lot of it you can direct at other bits to your light. You will also need to become an expert in abbreviations because the book is full of them. So I think the two books are really complementary, and I think that the book that I wrote with Dave and Larry really, it's kind of a theory of tinnitus book, whereas Hashir and Brian's book is more the practical. I think they work well together, and I would certainly recommend people to read Hashir and Brian's book. And I'm going to shut up and let them speak for themselves now. Thank you.
Okay, so what I want to do now is to go through a bit more about the general structure of the book. Now, as Don told you, the book is intended as a self-help guide for people with troublesome tinnitus. If you have tinnitus but it's not bothering you, then don't expect the book to be of much help. It's if your tinnitus is causing you problems, that's who the book is intended for. And it provides an alternative to treatment by a therapist or a clinical specialist in situations where waiting lists are long or help is not readily available. And as Don said, some of you may have had the experience of going to your GP and being told, oh, there's nothing we can do about it, go on your way. Some GPs will try to refer you to a specialist clinic, but there aren't many of those around. Waiting lists are quite long. So this is intended to let you try for yourself to get a grip on your tinnitus. So the general aims of going through the program described in the book are to get some relief from tinnitus distress that lasts a long time and is realistic. It's not based on false hope. We don't promise that at the end you won't have any tinnitus anymore. You'll still have your tinnitus, but you'll be better able to deal with it. And this depends on something changing within yourself, changing your own thought processes and reactions and how you deal with the tinnitus. And generally, we hope that this gives you the chance to be a more resilient and confident human being. The starting point, as Don said, is that there are at present no cures for tinnitus. You can't get a pill which is going to make it go away. Except in very, very rare cases, there's no surgery that you can have that will make it go away. So what we're trying to do with the book is to help you to manage your own reactions to the tinnitus. And throughout the book, we include worksheets that can help you as a sufferer to understand your own reactions to tinnitus and to identify whether or not those reactions are realistic. And often these worksheets will help to illustrate that your reactions at present, if you're bothered by your tinnitus, are not always realistic. You expect things to happen that maybe won't happen. You expect bad consequences that maybe don't happen. And there are also questionnaires in the book that can help a person with a tinnitus to assess the severity of their reactions to tinnitus and to monitor their progress. So you may want to fill in these questionnaires at different stages as you work through the book to see how well you're doing. And you may be surprised that the results indicate you are indeed making progress. And as was briefly mentioned in Hashir's response to Don, all of these questionnaires can be downloaded from the publisher's website, so you can have them as sheets. You don't have to write in the book necessarily. You can print out these sheets, and then you can print out as many as you want, so you can take them over and over. And the book is organized in 10 steps, and each step is illustrative with metaphors, real-life examples, and characters from history and fiction. We hope this makes it easier to remember some of the lessons in the book and makes it more entertaining, and it also helps to illustrate that you're not alone. Throughout history, there are people who've suffered from tinnitus, and some have developed their own ways of dealing with it, some never did manage to deal with it. but you have to realize you're not alone. Many people are going through the same thing as you. So step one is just to learn about tinnitus. This provides basic information about tinnitus. As Don said, it's rather brief. We try to answer the common questions that people with tinnitus ask when they come to the clinic. We try to deal with some common misperceptions about tinnitus, misconceptions, and we try to help you make sense of the experience of tinnitus. And tinnitus is often associated with hearing problems, so we also give some information about when you should seek help for hearing problems. And we include questionnaires that help you to decide whether you might have a hearing problem, and if so, you should seek help for that, separately from dealing with your problems with tinnitus. As Don said, it's an open issue of whether someone could have a completely normal auditory system and still have tinnitus, and there's still debate about that. Some people believe that tinnitus is always associated with some kind of slight disorder of the auditory system, but not necessarily one that's revealed by the audiogram, or at least the conventional audiogram. And finally, in this chapter, we give some examples of the kind of thoughts and reactions that people can have in response to their tinnitus. And you can evaluate for yourself how well you think these match with your own reactions and bothersome thoughts. So step 2 in the book is self-assessment. This step has the aim of helping us to evaluate our own experience of tinnitus and its symptoms and the extent to which these affect us. How much are they bothering us in everyday life? And this can help to decide whether to go further in the book. You might decide, well, actually, my tinnitus isn't so bad, I can handle it okay. And in that case, you may not need to work through the whole book. On the other hand, your tinnitus may be bothersome, and in this step of self-assessment, we help you to decide whether you really need help from a medical practitioner or if you can deal with this on your own by working through the book. And in this step, we provide several questionnaires that assess different aspects of tinnitus. One is the impact of tinnitus on you as an individual, your sensitivity to sounds in general, oversensitivity to sounds, which is called hyperacusis. This is where moderately loud sounds are bothersome to you, but they don't seem to bother the other people around you. Quite a lot of people with tinnitus have hyperacusis as well, but the two don't necessarily go together. There are also questionnaires about assessing the extent to which you have anxiety and depression, which often accompany tinnitus, and the extent to which you have hearing problems, where you might seek help to assess the origin of the hearing problem, maybe to get hearing aids. The third step is learning about CBT. What actually is CBT? So we explain the theoretical basis of cognitive behavioural therapy and why and how it's relevant to managing tinnitus. And CBT is based on a specific way of thinking about the distress caused by tinnitus, and Don gave a very nice overview of that with diagrams of these feedback charts. And in CBT, we think about how to treat tinnitus in terms of the interactions between our thoughts and our emotional and behavioural reactions to them. And this involves the limbic system, as Don said, the part of the brain that deals with emotions, not so much with conscious reasoning out of things, but something that happens more automatically, but which depends on our interpretation of the tinnitus or of outside stimuli in general. And learning about CBT can help you to understand how it might be useful in managing your tinnitus, how going through a program of CBT might help you to manage your tinnitus. Okay, the next step which Hashir calls it testing the water. This is where you're first putting your toe into the water and seeing if you like it or not. So this involves trying out some of the CBT skills to get a sense of how this might work. And these skills involve tackling avoidance behaviours and rituals and facing our fears. And so, for example, if your tinnitus stops you from getting to sleep, you might have a pillow sound generator or a bedside sound generator that plays some soothing sounds and maybe helps you to get to sleep. But one of the things we want you to do in practicing CBT is to get to sleep without using aids like this, to see if you can manage it on your own without artificial aids. So to face your fears, in other words. And by testing whether you have these skills, you can decide if CBT is something that you want to pursue. And this step also helps you to identify your key troublesome thoughts to do with tinnitus. We call these your hot thoughts, things that are dominating your thought processes. And we also talk a bit about when to practice cognitive behavioural therapy. So step 5 is finally moving on to the central part of actually trying out cognitive behavioural therapy and taking part, self-administering cognitive behavioural therapy. And in this step, you can take stock of what you've achieved so far in dealing with tinnitus via these questionnaires that you're taking as you go along, and to identify where things might be improved. And this step includes a questionnaire that can be used to self-evaluate your own confidence in managing your tinnitus and how you might improve that confidence. And this questionnaire is actually a new questionnaire that was developed by Hashir and his co-workers specifically to be a part of this kind of program where you can see how your confidence is changing over time. And filling in this questionnaire helps you to reflect on how confident you are in carrying out your day-to-day tasks, resting and relaxing and enjoying life without using any distraction or avoidance. And the questionnaire helps you to think about what you might be able to do to become more confident in doing these things. Now, step 6 involves customizing your treatment to suit yourself based on your own particular thought processes and emotions that are evoked by your tinnitus. So the idea is to create a model of a CBT model that's explaining why you're distressed by your tinnitus based on these various vicious circles that occur that Don talked about. And the model can differ from one person to the next. People can be anxious about different aspects of their tinnitus, troubled more about some aspects than other. And this model can be used to describe our own tinnitus distress by writing down our thoughts, our emotions, our bodily sensations and behaviours, how we react to all these things. And this provides another opportunity to think about which parts of the vicious cycle can be changed or modified. And this chapter includes a worksheet to explore personal and life factors that may have contributed to the initial reaction to tinnitus. How did you become bothered by it in the first places, and are there things in your life at the time or earlier that made you react in a particular way? So then we come to really practicing the cognitive behavioural therapy, and this step is called SEL. Sorry, another abbreviation. I know maybe we have too many abbreviations, but stop avoidance, expose and learn is what we have in this chapter. So this step is teaching us to avoid avoidance behaviours and rituals, expose ourselves to our tinnitus and learn from that experience. And during this process of SEL, we practice controlling our urges to use background noise or other distractions or rituals when hearing tinnitus, exposing ourselves to what we're afraid of, and learning if we can tolerate the uncomfortable feelings that tinnitus might produce. And most people find that when they do expose themselves to a feared situation, it's actually not as bad as they thought it would be. And this is measured quantitatively by these questionnaires, because you predict how bad it's going to be for you in a particular situation, and then later on you assess how bad it actually was when you faced that fearful situation and went through it. And simply by experiencing anxiety, irritation and sadness evoked by our tinnitus, we can improve our tolerance of these bad feelings and learn to deal with them. Now, this step is called Let the Sunshine In, step 8, and the idea is to turn what you've learned so far from the SEL stage into an antidote for our troublesome thoughts. And a crucial part of this is creating counter statements that are used to neutralize the negative tinnitus-related thoughts. People who are bothered by their tinnitus have a lot of negative thoughts about the tinnitus and what it will do to them, how it will affect their ability to sleep or do their job or enjoy life. And in this step, the idea is to create counter-statements that neutralize some of these negative thoughts, that show these thoughts aren't always right, there are exceptions to them. And these counter-statements have to have certain properties. They have to be relative to the negative thought that you're having, but contradictory to that thought. They have to be positively worded, and we have to be able to believe in them themselves. And this chapter helps you to make up your own counter-statements to fit in with your own particular beliefs and feelings about tinnitus. And this step can help us to blow away the dark clouds of negative thoughts and let the sun shine in. And these were words used by one of the patients who was attending Hashir's clinic. So that's where we got this phrase from, of letting the sun shine in. Okay, then there's the final stage. Gloves are off, as Tinnitus put it, as Hashir put it. So this step is called KISS, keep on, identify, and substitute. So this step is teaching you when to do CBT, which is whenever tinnitus is interrupting our activities or affecting our mood. It helps us to keep on in dealing with the negative emotions. It helps us to identify our negative thoughts about tinnitus and to substitute them with counter statements. So that's the KISS stage, another abbreviation. And it also helps us to revisit some of our rules of life and basic beliefs about ourselves and life in general. And it helps us to realize that some of these rigid rules of life are not always correct or productive or helpful, and you need to think about revising those rules of life. And step 9 helps you to do it. And then the last step, which we call CBT style, is about integrating CBT into your lifestyle, how to use it in everyday life to maintain your progress and to prepare for setbacks. And setbacks are part of normal life, and that's true of tinnitus as well. And if we're prepared, then it's less likely for these setbacks to escalate into a full-blown relapse. So setback might occur if you have a stressful event in your life, a relative died, or you've had to change job or move house. All these stressful things maybe lead to a temporary worsening in your tinnitus and your anxiety about it and the extent to which you're bothered by it. And so you need to be prepared to deal with those setbacks. And the main action is to resuscitate your CBT skills, or to make sure those skills are not forgotten in the first place, and to be ready to practice them quickly as needed. And so this step teaches you how to integrate these skills that you have learned about CBT into your own lifestyle. And I'll finish just by giving you a quote from one of our patients, where this patient talked about blowing away the tide of tinnitus distress. And she said, previously I'd been experiencing this tide, this huge tsunami of negativity, suffering, pain and anguish and everything, right from the time that my tinnitus started. Now I feel confident to blow away the tide. I don't need to avoid my tinnitus. Instead, I can use CBT to control my reaction to it, and it's a change from within. So that's what we're aiming to achieve after you've worked through the book. And I want to emphasize that you do need to work through the book in a sequence. It's best not to leap around from one chapter, but to read the book in a sequence. And it's best to take enough time over each step. Don't think that you can go through this in a few days, read it like a novel. You need to practice each step and become confident with it before you go on to the next. And that is most likely to lead to success in the long term.
So what I want to talk about is to some of the research studies that we have done, which informed some of the materials presented in the book. And one of those studies had two phases, and it was focusing on the relationship between tinnitus and sleep. So in phase 1, we had data for 417 patients. We analyzed them. We conducted a statistical analysis called mediation analysis to explore the mechanism in which tinnitus loudness can create sleep difficulties. And the second phase of the study, we looked into whether cognitive behavioral therapy can actually help people to improve their sleep difficulty, to reduce the sleep difficulties that they are experiencing. So this was the model that we created based on the data that we analyzed. At the top bit, the first part shows that the tinnitus loudness has a direct and significant relationship with the sleep difficulties. When we had a model which had only tinnitus and sleep difficulties included in that model. So that top part basically means the louder the tinnitus, the more sleep disturbances we have. But there are hardly ever only two factors in our experiences. There are lots of other different factors that needs to be taken into consideration. So we tried the second model, which is the mediation model, in order to understand if we include other related factors that people who have tinnitus also experience into this model, will the relationship between tinnitus loudness and sleep difficulties remain significant? So the model showed that the impact, the relationship between tinnitus loudness and sleep difficulties was fully mediated by factors like if tinnitus makes you feel depressed, if you're annoyed by your tinnitus, and if tinnitus impacts on your life. So the direct relationship between tinnitus loudness and sleep difficulties became insignificant when we added these factors into the model. So what does that mean? I'm going to explain that a little bit more. First with an example which is not tinnitus related. And imagine a woman, before she mixes an ingredient for a cake before leaving the house to work. And then she put the ingredients in the oven. When she goes to work at 4 o'clock, she calls her husband and asks him to make sure, turn on the oven. She wants the cake being baked when she's back from work. But the husband is forgetful. He only remembers to turn on the oven 50% of the time. So, therefore, every time that the wife calls, the cake does not necessarily being baked. So it is the actions of the husband is essential there. If he doesn't turn on the oven, the cake will not be baked. So now we take that to the context of tinnitus. Tinnitus is the telephone call, and cake is the sleep difficulties. So between the telephone call and the sleep difficulties, there are other things that need to happen for tinnitus to lead to sleep difficulties. And so before I explain that a bit further, so what is it? So obviously we want not to have the sleep difficulties. And so in other words, we want to avoid the cake from being baked. What to do? One option is to try to distract the wife, not to call. It's a hard thing because she likes the cake. So the second option is to work on the forgetful husband. And that, I think, is your best bet. Now, going back to this model that we created, so the model shows that if tinnitus makes you feel depressed, this one, or if you're getting annoyed by tinnitus, or it is impacting on your life, then you will have sleep difficulties. But these are the mediating factors, these are the actions of the husband there. Now, and cognitive behavior therapy can help you with this. Because in cognitive behavior therapy, you learn that there are cognitive behavioral processes between the loudness of the tinnitus and creation of the emotional disturbances that we experience. So in CBT, or cognitive behavior therapy, you learn to recognize those cognitive and behavioral, those thought process and actions that you are taking, and modify them. So you are not feeling depressed, although you're hearing tinnitus. You're not getting annoyed, although you're hearing tinnitus. So therefore, what will happen, so you are working on the mediation factors. So in other words, if you are hearing tinnitus, but you're not depressed about it, and you're not getting annoyed by it, then it will not impact on your sleep, or your sleep difficulties will reduce. So the second part of the study was to basically test that. So we had a group of people who enrolled in cognitive behavioral therapy focused on management of the tinnitus, and before and after treatment, we asked them, we used a standardized measure of insomnia to see if there is any change in their sleep difficulties that they are experiencing following CBT. And there was. Their score significantly reduced after the CBT. This study was not a controlled study, but there are lots of other randomized controlled trials on this topic, which having the same sort of result consistent with this. Well, thank you very much for listening.
Hi, I'm Cheryl. I suffer from tinnitus and hyperacusis, which resulted from sudden hearing loss. CBT helped me in that I'd quickly developed some habits and rituals that weren't helpful in managing my tinnitus. It led me to understand why it wasn't helpful and not to give tinnitus the attention. It also helped me in terms of identifying negative thought patterns and addressing those thought patterns with positive counter-statements, and realising that setbacks do occur and how to manage those setbacks. I think the book is a great resource and a great tool to reach a lot of people. I think it's a great reminder to be able to pick the book up, look back, use the book on a day-to-day basis, and refer to it as you need to as a reference point. I was fortunate enough to have a number of sessions, CBT sessions with Hashir. If someone didn't have access to that, then the book is a great self-help guide and tool, and it's also a superb reference point for me and myself now, looking back on those sessions.
Hi, I'm Alex, and I have tinnitus. So I have an extremely high pitch whine, I guess, which is 24/7, 365, and it's louder than anything else. Sometimes I'd be in the cinema and it'd be louder in the cinema. It was caused by a car accident where the side airbags went off next to my ears. The CBT helped me, I slightly didn't expect this, but it hasn't particularly reduced the volume of the noise itself. However, it has drastically changed how I respond to it, and even subconsciously. So I'm now able to relax, sleep, clear my mind, and get on with normal life in a way that I couldn't when the tinnitus was at its worst treatment. I think it's great because it will enable everybody to go through the steps of CBT to help their tinnitus, whether they can afford treatment or not. They can afford the book, they can help their tinnitus if the CBT is appropriate for it. And it will also help me to remind myself of the tools that I learned during the CBT sessions. So I had a full course of the CBT treatment with Hashir, and I think the book is great because it will enable the techniques to be more accessible to more people than those that just have the sessions, and it will remind me, it strengthen my tools to deal with my tinnitus in future. So I was initially quite skeptical about CBT to help my tinnitus. It just felt like a very physical thing. I was very surprised how effective it has been to every aspect of my life that tinnitus was affecting, because at the time it affected everything. So it's been a huge help, and I'm very thankful for that.
My name is Dr. Laure Jacquemin. I'm a clinical audiologist from Belgium. I work for the Antwerp University Hospital as a postdoc researcher, and I provide CBT to patients. To be fair, I have been providing tinnitus therapy for a while, and the CBT techniques really help me to bring my therapy to another level, where in the past I could educate my patients and I could reassure them about what tinnitus is and that it's not the scary devil that we sometimes think it is. But with CBT skills, I really could gain more skills in psychology to also reduce their levels of anxiety, their levels of depression. While definitely not being a psychologist, I have some skills to help them. Well, I see them for their tinnitus. I can also help them with the anxiety related to the tinnitus and the mood swings they might experience because of the tinnitus. I also learned how to do CBT from Hashir in a quite structured way that I think resembles very well the book. And I'm not a psychologist, so I don't think it's needed for the patient per se to see a clinical audiologist or a psychologist for their problems. I think the book can guide them through that process. So I think for some patients, it might be enough to go through that experience of going through the CBT process and having this kind of mind switch, which I think is crucial to any therapeutical success. Of course, I think it can also go hand in hand, where you might see an audiologist for some psychoeducation and some reassurance on your problems, but you might do that hand in hand. So I think the one doesn't exclude the other, but I definitely see the benefits for patients. Also with waiting lists, while they're waiting, they can already start tackling some stuff, and that might make the therapy afterwards even quicker and more efficient.
Welcome back. We're now going to take your questions, and I'm going to ask the panel a few questions on your behalf as well. So does anybody have a question to start with, a burning question that they would like to ask to anybody on the panel?
Thanks. In the first part of your presentation, you talked about the loudness of tinnitus. I wonder how you measure the loudness of tinnitus, because it's surely a perception in your head.
Exactly, and so there are different ways to estimate the loudness of the tinnitus. The one that we have used is called visual analog scale. So it's asking the person who perceives tinnitus to rate the loudness of their tinnitus from 0 to 10. We explain for them that 0 means no tinnitus and 10 would be the loudest possible. And that number that they give, that would count as the loudness, tinnitus loudness on that visual analog scale. It is variable, but it is this visual analog scales have been used for other things as well, like for measurement of the pain, another perceptory thing. There are other measures that I haven't used in my research to measure tinnitus, which I think Brian has done some studies on them.
Yeah, another method that has been used is to present an external sound and give the person the knob so that they can adjust the intensity of that sound and ask them to adjust it until its loudness is the same as the loudness of their tinnitus. Many people find that quite difficult to do. And one problem is that it doesn't necessarily capture how loud the tinnitus is in everyday life. It just captures how loud it is at the moment when you measure it in the laboratory. So it doesn't give a complete picture. And there are various problems in interpreting the results. So the method that Hashir described is the most straightforward. Just get the person to rate it. And most of us are familiar with this with pain. Often if you go to your doctor, they'll say, well, on a scale from 0 to 10, how painful is this? You know, and you can give a number, and you can do the same for the loudness of sounds, and it seems to be reasonably reliable. So that's I think our preferred method that we use.
If I add, is not tinnitus related, but during the COVID pandemic, I called my dentist. And I said, well, I have toothache. And so on a scale from 0 to 10, how painful it is. I was thinking, what number should I give for them to see me?
We had a similar question. I think that pretty much mirrors some of what you've said.
Exactly. Or with the brain scan. Any type of the brain scan.
So the question is, can tinnitus be measured or quantified by any type of brain scan or measurement of electrical activity? This is a difficult thing to do because many areas of the brain are active simultaneously, so how would you know sort of where to look to find something that corresponds to tinnitus? It can be done in some cases. People have what is called somatic tinnitus. Their tinnitus can be modified by pressing on the face or the neck or somewhere, but the sensation of the pressing on the skin actually changes the tinnitus sensation. In my own case, my tinnitus changes when I shake my head like that. So you can do a brain scan for these people with that kind of tinnitus where you look for changes when you sort of press on the trigger point on the head or the body where the tinnitus changes and get an idea in that way. And such changes have been used to detect tinnitus. As far as I know, the brain scans or electrical activity have not been used to quantify tinnitus, to estimate how loud it is, for example, or how bothersome it is. But there is, at least from these people where the tinnitus can be modified by touch, you can see some areas of the brain that respond when that happens. And consistent with the sort of model that Don was talking about, this can show up in the limbic system as well as in the auditory system, for example, the parts of the brain that respond to sound.
So this is one of the huge problems of tinnitus research. It's one of the things that really is holding us back, is that there isn't an easy way to measure it. It's not like blood pressure. And it's difficult to know if the treatments that we do are making a real effect. What we want is what is called an objective measure of tinnitus, something that you can actually stick a number on that isn't needing the person with tinnitus to put an X on a line or to fill in a questionnaire or anything like that. All the things that we do have are called subjective, so they need the person to supply the information. And if we did have an objective measure, it would make our lives a lot easier. We've looked at a lot of things. We have looked at MRI scans, and we have compared. So there are two sorts of MRI scans. There's the sort that you have when you go to hospital, which is looking at the structure of your body, and then there's something called a functional MRI scan, and that shows bits of the body that are more metabolically active. And if you compare people with tinnitus and people without tinnitus, you do see different bits of the brain being more active in the tinnitus people. And as Brian said, it's not just the hearing bits of the brain, it is also the emotional bits of the brain. It's the same bits that you would expect to see lit up if someone had anxiety or depression. We've also looked at stress hormones. We've also looked at EEG, electrical activity in the brain. We've looked at various other chemicals in the blood. At the moment, we don't have that objective measure. We're trying again to see if we can revisit that. The British Tinnitus Association is leading on a big project called a Tinnitus Biobank, which is going to try and get information from thousands or maybe tens of thousands of people with tinnitus and compare them to people without tinnitus to see if we can find something that can be used as an objective measure. But yeah, it's a big problem.
I think I'll just add something. Now that British Tinnitus Association is working on this idea, I always thought that in the fMRI studies, when they shown some increased activities in the people who had tinnitus, as you discussed already, they also have anxiety and other symptoms which can also lead to that increased activity. Perhaps those fMRI studies should be done on people who have tinnitus but are not bothered by it.
Yeah, and there's always a chicken and egg too. Have they got the anxiety because they've got tinnitus, or have they got tinnitus because they've got anxiety? It's a very complicated thing. We've got a very patient hand waiting.
Let's take a question there at the back. We've got Laurie and Daniel here with the microphone.
Just following on from that, so some of the early studies in patients with psychiatric disorders were looking at people who had had brain injuries, and that's how some of our early research into understanding how different personality disorders and things developed. Has there been any research with patients who've maybe had strokes in different areas of the brain or other neurological or cardiovascular diseases that affect the brain to see, because there seems to be a body of evidence suggesting this is a neurological condition as much as it is, or even more so, than an auditory condition. So is there any sort of almost reverse research in that way to see people who've had other conditions and see if they have a higher incidence of tinnitus or hyperacusis?
Probably you should
So, yeah, we have, again, we've looked at the coincidence of various conditions, both with tinnitus and with disorders of loudness perception. And there are a few, so tinnitus and anxiety, tinnitus and depression, tinnitus and hyperacusis, and vice versa. Hyperacusis people are more likely to have tinnitus. And then a lot of the things like chronic fatigue syndrome, less so with the evidence on things like hypertension is much weaker. It is mostly things that have a psychological basis rather than a physical basis.
Hands at the back there.
Yeah, thanks for that. Could you tell me how rare it is to get tinnitus in one ear only and why?
Very common. Yeah. So if you look at everyone who's got tinnitus, if about just over half have tinnitus that's either in both ears or in the middle of the head, just over a quarter have it in the left ear, and just under a quarter have it in the right ear. And no one knows why left tinnitus is more common than right tinnitus. It just is. Even if you divide people up into whether they're left and right-handed, you still get the same. Some people also have it as a sort of around them, not inside them sensation. And that's particularly so at early stages of tinnitus. And it's quite a common story in the tinnitus clinic to hear someone say, "Oh, I got this noise and I drove myself potty for the first fortnight, going around the house, turning off all the appliances to see where the noise came from. And suddenly when I went on holiday to Greece and I realised that the noise had followed me, and it then jumped inside." So where people feel their tinnitus is kind of the best guess as to where it's their brain trying to make sense out of something that it doesn't fully understand.
There's a new study that Don, Brian and I collaborated on. We assessed the audiological factors as well as psychological factors between people who have unilateral tinnitus and bilateral tinnitus. The study actually is not yet published. It will be published in the next few days. So you are hearing the news of tomorrow. And so there was, in people who had unilateral tinnitus, there was a bigger gap between the hearing thresholds between the two ears. The ear with tinnitus had worse hearing compared to people with bilateral tinnitus. And also, there was no significant difference in the impact and annoyance and loudness of the tinnitus between unilateral and bilateral. So in terms of the psychological effect of it, because I hear that all the time, the patients who have only tinnitus in one ear, they say, "Oh, it's much worse because it's not balanced." People who have it in both ears say, "Oh, if I had it only with one ear, I could cope, but now it's in both ears." So the study showed that, whether you have it in one ear or both ears, it could be equally annoying. And so.
We had some raised hands over here, this side of the room. Yes.
Hi, thank you. So 2 questions, if that's not too greedy. And you may have already started answering this. So any research to indicate metabolic health, so that tinnitus comes from poor metabolic health? And then the second question I had is the use of hearing aids. If one starts exploring that, sort of, is there any indication that tinnitus could be more pronounced, or just open to the panel? Any of your thoughts? Thank you.
Do you want to start?
Yeah, maybe I can answer. Let me answer the second part first, about hearing aids. We discuss this issue in the book, and we suggest that people should only get hearing aids if they actually have a hearing problem. If their audiogram shows an abnormality, or if they have difficulties understanding speech, especially in noisy situations. Now, some people, when they're fitted with hearing aids, do say that their tinnitus seems to get a bit softer after a while. So they can help with that. But in the book, we suggest not trying to use hearing aids
as an avoidance technique. If you have normal hearing, we don't think it's a good idea to use hearing aids just to try to reduce the tinnitus. But if you have a hearing problem, then that should be dealt with anyway, and it may incidentally help with tinnitus a bit.
And the opposite of that, I may add, that sometimes people, when they use hearing aids, they feel that it impacts on their tinnitus in a negative way. And specifically in people who also have hyperacusis, which are sensitivity to sound. Again, for those people, they start not using their hearing aids in the fear that it makes the tinnitus worse. And the advice is not to do that, because not using hearing aid in that circumstance becomes an avoidance behavior.
So there are some sorts of hearing loss that are amenable to treatments other than hearing aids. Particularly there's a condition called otosclerosis, which is a disease of the bone that conducts sound from the eardrum to the inner ear. And you can do an operation on that. And we know that people who have tinnitus in association with otosclerosis, the tinnitus is very likely to improve if they have the operation and the operation improves the hearing. So I think most of us, if someone has a hearing loss, the first thing we would do would be to try and improve the hearing loss. One shouldn't be able to get a hearing aid with normal hearing. No self-respecting audiologist would.
Well, if I can just respond to that. There's increasing evidence, I think, that people who have experienced hearing difficulties, even if their audiogram is within the normal range, get some benefit from low-gain hearing aids. And there's probably 3 or 4 studies out now showing that. And it may indicate that the person has some kind of underlying disorder that's not showing up fully in the audiogram, and just having things like directional microphones in hearing aids can improve the ability to understand speech in noise. But I agree, I mean, routine clinical practice is not to give hearing aids to people whose audiograms are within the normal range, but there are a number of research studies showing that even very mild hearing loss that you would still say is within the normal range can be associated with hearing difficulties where people can benefit from hearing aids.
The other example is people who've got a profound hearing loss, they've got no hearing at all, and even the most powerful hearing aids don't help. If they undergo surgery in the form of cochlear implantation, that is more likely to help associated tinnitus. It doesn't always. It's like everything in medicine. The words always and never don't really exist. But if there is something that you can do that will improve hearing, by and large, it's good for tinnitus.
Did that answer both of your questions?
Just the other question around whether there's any links between poor metabolic health.
Which specifically?
Blood sugar, dysregulated blood sugars, diabetes.
Yeah. Yeah. Without the figures in front of me, I can't remember if.
I was just.
Yeah. It's not a big association.
Yeah.
There are some links with diabetes and hearing loss.
Yeah.
And hearing loss.
Yeah. The diagrams I showed at the start, I mean, they showed that the auditory system is not just the ear, and the auditory brain is important, and that's important for the hearing bit as well as the tinnitus bit. How the brain processes the information is part of the jigsaw, and that's. It all goes into something called auditory processing disorder, which was one of those abbreviations on my word map.
And an auditory processing disorder at one time was called central auditory processing disorder because it was assumed it was all in the brain, but now people tend to just call it auditory processing disorder because some of it may occur in the cochlea itself and some of it may occur in the brain, and you're often not sure.
We have progressed a bit in that it also used to get called obscure auditory dysfunction, which sounded rather pejorative.
We have a question here, blue jumper.
Thank you. Outside the door here, we have the Royal National Institute of Deafness. And you're talking about auditory. Would it not be a good idea to ask them about tinnitus and members?
But they have a tinnitus as part of their setup, and they liaise quite closely with the British Tinnitus Association. So yeah, that's already happening.
Good.
Yes, their main mission is to basically eradicate hearing loss and helping people with hearing loss. But tinnitus, because it's very common in people with hearing loss, it does come under one of their subcategories.
So if a person has severe hearing loss, they still can get tinnitus?
Yes. Yes, many people with hearing loss have tinnitus as well, about 60% of them. But tinnitus can be present in people who have normal hearing as well. And
we had a question around tinnitus starting after breast cancer surgery. And the question is it common to be triggered by illness or trauma?
For sure, anything stressful in your life can trigger tinnitus. And if you've got tinnitus already, any stressful event can make the tinnitus worse. Breast cancer is interesting. There's nothing specific about surgery for it that's any different from any other sort of major surgery. But some people with breast cancer also get treated with chemotherapy, in particular the platinum-based drugs, and they are one of the few drugs that has a definite tinnitus-causing action.
Yeah, I mean, those drugs can also cause hearing loss, of course.
Yeah, absolutely. I mean, that's probably... There are, although most, if you unravel that increasing bit of paper in the packet of tablets that you've been prescribed, almost all of them will feature tinnitus somewhere on it. Not very many people have to report tinnitus before the drug company has to mention it on the blurb that goes in the drug packet. But there are very few that it really happens to a big extent. The anti-cancer, some of the anti-cancer drugs are one. Some high-dose antibiotics, particularly something called gentamicin, high doses of aspirin, but it is very high. You wouldn't. We use, or not me personally, but some tinnitus researchers do animal research on tinnitus, and they use aspirin to generate the tinnitus. And the equivalent dose would be me having about 100 aspirin tablets. So the two tablets for a headache is not going to have the effect. And very high doses of quinine can also trigger tinnitus. But it's the sort of dose that you might get if you had malaria and were having to be treated for it. It's not the dose that you would get if you were going on holiday to somewhere with malaria and you were taking a quinine-based drug to prevent you getting it. And it's certainly not the dose that you would get in tonic water I did the maths once, and you would need about 90 gin and tonics to give yourself tinnitus. I think probably by that stage you're not going to be too bothered.
When you say going on holiday, there's a question at the back. Yes, please. We'll bring the microphone to you. When you said going on holiday, I thought you were thinking of the bar rather than the malaria tablets.
Hi. I was just wondering if there's any correlation, or if you could shed some light on possible correlation between other hearing oddities. So, for example, I've got 4 different things. I've got the tinnitus. I have what I call white noise, so just a constant buzz the whole time around. I struggle differentiating sound, so in a conversation in a noisy area, all the periphery sounds, be it clinging glasses or whatever, are just as loud as the conversation in front of me. And the 4th thing is, yes, that hypersensitivity to sound. So if there's a conference meeting, we've got a speakerphone, my colleagues will put the volume up really loud to try and hear better, and for me it's better and I hear better if the volume's lower. But is there a correlation between those auditory things?
Probably you can.
Yes is the short answer.
Yeah. The thing is, many people with tinnitus have hearing loss. We think it's the hearing loss that creates the difficulties in understanding speech in noise. It's not the tinnitus, but many people with tinnitus are of the impression that the tinnitus is somehow interfering with their ability to understand speech. And there's no really direct evidence supporting that. It's probably that the hearing loss associated with the tinnitus that's producing the difficulties understanding speech, and not the tinnitus itself. I mean, it's a hard one to directly address experimentally, but our view we discuss this in the book, and our view is that at present there's no evidence that tinnitus itself interferes directly with your hearing. It may affect your concentration, of course, and it may affect the effort that you're willing to put into understanding, but we don't think that the tinnitus is having a direct masking effect on speech, for example.
And there was this study that I've done with a colleague, Richard Sulvey, one of those people who use aspirin to deafen guinea pigs. And in that study, we realized that there is a relationship between tinnitus loudness and severity of hearing loss. So the more severe hearing loss is associated with a louder tinnitus. And so a person with a louder tinnitus may find it harder to hear conversations. It may not be because the tinnitus is louder, it's because they also have a more significant hearing loss. And so again, to be consistent, the answer is yes, there are significant correlations there going on between tinnitus, hearing loss, and hyperacusis.
And you also noticed one of the things about hearing, that making something louder doesn't necessarily make it clearer, and that is very true. I had a personal demonstration of that. I was at a concert of the Blockheads, of Ian Dury and the Blockheads. The band continued even after he died, and they were very loud. And I, being a good ENT surgeon, I had some musicians' earplugs, so I put them in, and that attenuates everything by about 20 decibels. And not only was it much more pleasant, but I could actually hear the lyrics much better. Louder is not always better for hearing loss.
We have quite a sensitive question here, which is, my son suffers from hyperacusis and at times has been so depressed as to have suicidal thoughts. What advice can you offer to my wife and I about how best we can support him when he's feeling down?
Well, it's very complicated because definitely they need to be seeing a psychiatrist and be under their care. However, the psychiatrist can become a bit confused because of the problems of hyperacusis. And so ideally, they need to have two therapies parallel together. The priority given to the risks, so therefore the psychiatrist needs to take the priority, start the treatment, and then parallel with that, a specialist for hyperacusis can provide cognitive behavioral therapy to improve their management of hyperacusis. So the two need really to go together as far as I can say.
Question over here at the front.
It's leading on from that point, actually, hyperacusis, because my wife has developed really bad hyperacusis. She's also got very bad aggressive tinnitus. I've understood, yes, psychiatric, and I've understood CBT as well for that. But what about sound therapy? We've been told that sound therapy not only helps to be used as a tool to relieve the aggressive tinnitus as some sort of masker, but also can that, or is that a key tool to get that hyperacusis back under control?
So you're going to hear different stories from different people here. So the book goes into quite a lot of detail about not getting hooked on using sound to distract the brain from tinnitus. And it gives a very reasoned argument as to why that should be. And it's something that psychologists call safety behaviour. And the book is clear that trying to break that cycle is good. I think hyperacusis is slightly different because if you've got a problem with sound tolerance, and particularly if you've tried to make your life quieter and quieter, you think that that's sensible, but the more you withdraw from sound, your brain then goes, where's my sound gone? And turns up the central gain control, which makes the problem worse and worse. So the quieter you make it, the more sensitive your auditory system becomes. Trying to break into that is quite often helpful in my clinic. And using sound to desensitize that oversensitivity is helpful, and a lot of people would use sound therapy in that situation to try and improve the sound tolerance. Indeed, we have an expert standing up there against.
Yeah, if I can pick up on that, I think it's more, can you use it as a tool to expose yourself in a way, like to provide sound to your brain, and because indeed people with hyperacusis feeling that sound is bad for you, it's doing something bad, but it's actually doing something good, so it can help to gradually expose yourself, which is in a sense also what's done in CBT, but you will expose yourself to sounds in the environment more, while sound generators can help you to expose yourself to a specific sound. So I think the two can go hand in hand and don't exclude each other.
When I was starting my sort of tinnitus career, sound therapy was very much the thing. And people were fitted with things that looked like small hearing aids, which were called maskers, and told to sort of use them to drown out or to partially drown out the tinnitus. I think most of us have moved away from that. We haven't completely disregarded it, but it's much less common now than it used to be. One other issue is in the bedroom, where a modern, we've all been persuaded to have highly insulated houses to save energy, and as part of that it's also made them increasingly soundproof. And a modern bedroom is probably a quieter environment than the human auditory system was ever designed for. So you can make an argument for having some sound in the bedroom, but I do agree with what Hashir and Brian are saying and what is said in the book, that don't become over-reliant on that. And my advice to my patients is, if you want a bit of sound in the bedroom, then yeah, okay, but you want it at a very quiet level, so if you're pottering around, you aren't aware of it, but it's there as a kind in the background if there's no other sound. You don't want it loud, you don't want it trying to drown out the tinnitus, and if you're going to do that, perhaps it's best to get one of these devices, get one with the mains adapter, just switch the thing on and leave it on 24 hours a day, so it's not drawing your attention to it, it's not becoming one of these rituals that you associate with tinnitus. It's just something there in the background. Or get an indoor water feature, or the oxygenator and a fish tank, or something that's going to be there the whole time and it isn't part of the tinnitus routine. I'll now hand over to the don't do that brigade.
I think it's fair to say that there is research evidence supporting an approach of including sound therapy as part of the treatment, and there's research evidence supporting the sort of approach that Hashir and I have written in the book, which tries to not use sound to sort of as an avoidance behaviour. And I think the evidence at present is just not good enough to say one is definitely better than the other. Both approaches are possible. We think that at present the evidence base is stronger for this kind of cognitive behavioural therapy approach that we've adopted in the book. But more research is clearly needed, and there are some people who advocate sound therapy for hyperacusis, and the claim is that the levels that you find uncomfortable can be brought up a little bit by long-term exposure to sounds. So it's not a clear-cut issue. We can't definitely say one is better than the other. And I think, to some extent, you could try the different approaches and see what works for you. But we think that present the evidence supports the sort of approach that we have in the book that suggests not using background sounds as part of an avoidance behaviour.
And following that, I'm not aware of any study which compares CBT on its own, CBT and sound therapy, and to see whether I doubt that if there is any study like this, would actually show any difference. The only, we have been using a lot of sound therapy devices in the past, but in addition to education, counseling, other things that we were offering to the patients. And times again, when we were doing surveys asking people which intervention did help you the most in managing your tinnitus, three things usually came at the top. First, to my surprise, I expected to be CBT, but the first was counseling, as a person listening to me and understanding my problem. Any survey that we have done, this came first. The most important thing that helped another person to manage their tinnitus was to sitting with the therapist and the therapist listening to them and understand their problem. And the second, again, not CBT, was education. Learning about my condition helped them. And the third was CBT. And but further down the line were sound therapy using this device and hearing aids, so on and so forth. So there's only one problem is, yes, definitely I agree with Brian that, and also with Don and Laurie, that you can try sound therapy, that's absolutely fine. But when you have a very severe case of hyperacusis or tinnitus, That severity basically means that there are a lot of psychological disturbances going on, and definitely they would need a CBT heavily focused on managing their tinnitus, and using sound therapy or other stuff like that is going to somehow sabotage the actual progress that they can make in that CBT program, because the message that the CBT it wants to promote is that you can sleep even when you're hearing tinnitus. But when they are using a sound in the bedroom, so the message that they get is that you can sleep only if you're using this sound. So the tinnitus doesn't become insignificant enough. So in CBT and other treatments that you have with tinnitus, you want to make tinnitus insignificant, so the brain doesn't focus on it. And CBT aims is for the person to get to this realization that I can do this and that without having to rely on any other activities. And that will basically make tinnitus very insignificant. But other approaches that have that problem, but with people who are not that much bothered by tinnitus or hyperacusis, yes, certainly they can try. But for severe cases, I think that focusing on a CBT approach combined with psychiatric support is the key to that. That's my own opinion.
Question over here.
Thank you. I've got lots of questions, but I'll keep it short. So I've had tinnitus for probably 10 years or more, and actually predominantly in the left ear, so I've learned something tonight about the left, right, unilateral, bilateral. In recent years it seems to have increased, it's got worse, and I just wondered if there was any evidence or truth in any of the claims that COVID or even the jabs have brought about an increase in tinnitus. It seems to be, I seem to see a lot of it on the internet. I haven't done any sort of in-depth research, but certainly a correlation for me that the last couple of years I've had COVID and all the jabs, and does seem to be a pattern, but I don't know, is it just a coincidence, or is there any evidence to back that up now?
So way too soon to say. Come back and ask that question in 10 years, and then we may have a better notion. So there are lots of suggestions that yes, COVID has made it worse, and you can see that there could be some direct effects there. We know that the coronavirus can affect the neural system, so it could have a direct effect. We also know that when it started, it was a major upset to our lives, and it was quite stressy. We didn't know whether we'd get COVID and die. We didn't know whether we'd get loo rolls, and we didn't know, there were so many stress things going on. It also got much quieter, and we were also stuck at home and not interacting with other people as much. So there were a whole load of things that you would expect to make tinnitus worse, kind of indirectly there, as well as the potential for direct. The vaccinations, the reporting system suggests that yes, there have been some people reporting tinnitus with vaccination. But if you've got tinnitus already and you've got to go and have the vaccine, you're going to get anxious about it, and you're going to, only naturally, you're going to worry about whether it's going to do something to your tinnitus. Just like if your GP wants to change your antihypertensive medication or whatever. And you do a thing called monitoring then, where you listen to your tinnitus to see if the vaccination is going to make it worse. And because you're listening and looking out for your tinnitus, it does go up. And it's the monitoring probably rather than the vaccine. But again, who knows for sure? The vaccines are novel treatments too. This type of treatment's never been used before. So we don't know whether they're going to have... We are the guinea pigs for this. We don't know if there are going to be long-term sequelae to it. We just got to wait and see. And you've then got to... we reckon... we don't know for sure the incidence of tinnitus. That's the number of new cases of tinnitus that arise each year. We're not completely sure about that, but probably it's about, your risk is probably about 1%, so 1 in 100. So that means that maybe there was somewhere around 600,000 people in 2020 who were due to get tinnitus anyway, just because that's how many people do normally. If they got tinnitus in the time of COVID, there is a tendency to blame it on the COVID, whereas it might just have been utter coincidence. It's very difficult to do that. It's one of those things where you would need to look and see if there's been an excess number of cases of tinnitus in that time period. But we don't keep really good records of how many people get tinnitus. Even from GP records, it's not wonderfully documented. So it may be that we never really answer that question, but it's certainly an interesting question.
That brings us up to 7 o'clock. I've got one more question that was handed to me. Should we do that one and make it the last one? So the last question is, to feel better, I like to understand my condition. How can I be hearing noises in my head if my ears are, in inverted commas, perfect, and the noise doesn't appear to be coming from my ears?
You don't need ears to have tinnitus, you need a brain.
There are two possibilities which Don alluded to. One is that your hearing may not necessarily be perfect, even if your audiogram is normal. And for example, we now know that with increasing age and with noise exposure, you can get damage to the connections between the hair cells in the cochlea and the neurons that make up the auditory nerve. And this is called a loss of synapses or synaptopathy. And by the time you get to my age, on average, you've lost 65% of the neurons in your auditory nerve, which follows on from this synaptopathy. So you might have a normal audiogram, but still have a hearing disorder that's associated with tinnitus. So that's the first possibility, which I think is quite a likely one. But let's say your auditory system is still functioning normally, at least the peripheral part. It's still the case that there are many central mechanisms that are constantly adapting to the signal that's coming from the periphery. And we know from animal experiments that if you just change the statistical properties of the sounds that an animal is exposed to, you get all kinds of changes in the central auditory system. And there's all kinds of balances between excitatory processes and inhibitory processes that are trying to turn things down. So you might have a perfectly normal cochlea, but some imbalance in these processes in the brain itself could lead to tinnitus. And one thing that we know, as you get older, there's a loss of so-called inhibitory neurotransmitters that are the ones that tend to push down the neural activity. And so an imbalance between excitation and inhibition in more central structures could give rise to tinnitus, even with a completely normal cochlea. So both are possible at this stage.
I think the cochlea is overstated in tinnitus generation, and there may be 3 people in this room with normal cochleas. The rest of us have all got some damage to our cochleas. We've been on the planet long enough. if that is true, then why doesn't everyone get tinnitus? If you look at the figures of, if you live long enough, you will get a hearing loss. Yep.
Sure.
But if you look at the rise in tinnitus, it comes up and then it levels off. It doesn't keep rising forever like the hearing loss one. And there are lots of people who have hearing loss and don't have tinnitus. I think it's more to do with what's going on in the brain bits of hearing than the auditory periphery, though I accept that if you look hard enough, you will find some auditory deficiency in most people with tinnitus.
I wouldn't like to argue at all that central processes are not important. I think they are crucially important, but I think that sometimes the initial trigger for tinnitus may be an abnormality in the cochlea that leads to subsequent.
Sure, and that indeed, that's what I said, that one of the triggers is your hearing going down. But you in the clinic, you frequently hear, yeah, no, my hearing's been the same for years, it hasn't changed at all, but it happened after I had to go to court, or it happened after Mum died. There's an event, there's a life event attached to it.
Another possibility is that because tinnitus is a perception of a sound with no real sound being there, so you're hearing something that doesn't exist. I told this to one of my patients and he said, he kind of liked it, and he said, yes, I'm not going to let this sound, which even doesn't exist, to ruin my life. And but you know, so you don't have to have a hearing problem for your brain to start noticing sounds or different things that that people with tinnitus may have.
Thank you. Should we thank the panel and thank all of you for your wonderful questions?